Amy. I'm a final year medical student from the University of Melbourne in Australia.
And I'm Cara and I'm also a final year student from Australia.
Prior to starting my medical studies, I did a Bachelor of Science, a graduate diploma in genetic counselling, and also completed a PhD which was in public health genetics and looking at ethics as well.
And I did biomedical engineering and then a PhD in tissue engineering before I did this. And I guess our background before coming, we've both travelled a lot. You know, we're a bit older doing medicine, so Amy's lived overseas. I did an exchange when I was in high school. You know, we really both enjoy travel and we're excited to explore a new country like Belize.
We first came into contact with Rondine and Tuklin education programs because we were having trouble getting in touch with the hospitals directly. But it became clear pretty quickly that the kind of experiences we would get through doing our placement with a program like TEP would be a lot broader than we would be able to arrange ourselves. So the program that has been put together for us isn't just a medical placement, it is a cultural immersion program that has involved a lot of fun activities that have helped us gain more from our day-to-day experiences in the hospital. So from organising homestays to getting being put in contact with community health workers, doing medicinal herbal trail walks, things like that we wouldn't have been able to arrange ourselves, is what I guess eventually drew us to doing the program. And yeah.
I think also from a practical perspective, coming to Central America from a country like Australia or the US, you kind of are worried about the safety and logistics of getting around, and so having someone like Rondine who's so specialised in all of this has really made it so much easier. We didn't have a lot of time either this year before we came, so it was amazing just to have it all sort of sorted out for us, all our transport worked out, all our accommodation, and so from a practical perspective as well.
We didn't really have to worry about anything.
No.
It's just done for us.
In terms of the feasibility of doing a medical placement somewhere in Central America, the language was a big problem for us because neither of us speak very good Spanish. So I guess that's what sort of drew us to Belize, but the more we found out about it and the more that we sort of started investigating it, it sounded like an amazing place with lots of different landscapes and people and
vibrant culture.
Yeah. So
I'm glad we chose it now.
Yeah, me too.
I honestly can't think of any time during this trip that I felt my safety or health was threatened at all. Obviously there's things when you're doing something like a medical placement that you naturally need to be more aware of when you're in a country that has a higher prevalence of HIV and things like that. But I think the places we've been at, the practices have been really safe, and I certainly, where we've stayed, haven't felt threatened.
We walked around everywhere and we got cabs and walked around, and I never felt unsafe at all, which to be honest I was kind of surprised about, but yeah, no, it's been probably, I felt safer than I do at home a lot of the time.
Yeah, absolutely. Yep. I guess here, because we've been the only medical students on placement at those institutions where we've been hosted, we've really had a lot of opportunities given to us by the doctors to get involved with things and be around when kind of the action's happening, and we've helped being able to help in a lot of cases, which has been really nice. I think another great thing about the program has been the opportunities we've had to reflect on our weeks, so meeting with Dr. Loskett and Rondine on a weekly basis and actually talking about some of the things we've encountered, and then taking those kind of thoughts and reflections with us into the next week have really helped give some depth to that experience.
And I think, as we've spoken about, will probably help us as we go home and medical programs there, and with all our bad experiences yet to come.
I feel a lot more confident now. I mean, we're about to enter our final year of med school. You do have a lot of uncertainty as a medical student about when it comes to crunch time, how you're going to be able to handle stressful situations. I think having this experience has made me feel a lot more confident about my clinical skills, about my ability to make a diagnosis, to be able to instigate treatments or do things without necessarily using a lot of tests or having a lot of equipment around. I don't think we've faced any major challenges, but of course, you know, any time in medicine has challenges every day that you face, and a lot of the things that could have been challenges for us, like perhaps finding places to stay or getting around, assimilating into the culture, learning about different aspects of the culture, have probably been helped by being a part of an organised program.
Just come into the program with a really open mind and willing to try everything. It's been amazing the things that we've been given the opportunity to do, and yeah, it's been such an amazing program put together for you, and I think you get the most out of it when you just are willing to give everything a go.
People that we've encountered during this time have been so gracious with their time and help. It made me think about if you want to bring some small gifts to give to people that you meet along the way, especially something nice or symbolic from your own country that they might appreciate, because I've actually usually pretty good with that, but I forgot on this trip, and I'm kicking myself that I didn't bring more things that I could have shared with the people I've met along the way. So that's just a little tip.
Yeah, I think everybody really loves learning about your culture as well, so to be prepared to have some things from home or tell them some stories, show them pictures, all of those kind of things, they really enjoy that too.